name is Carla Sáenz. I'm PAHO's Regional Bioethics Advisor. PAHO's Regional Program on Bioethics is part of our Department of Health Systems and Services. I'm very glad to be here with you today to present our upcoming publication, Catalyzing our Ethical Research in Emergencies, Ethics Guidance, Lessons Learned during the pandemic of COVID-19 and Pending Agenda. I'm going to share my slides with you. Okay, I'm going to start by sharing that this is a regional production that aims at improving our ethical preparedness for future health emergencies. So this publication integrates, revises and supplements prior publications of PAHO's regional program on bioethics on ethics and COVID-19. So on top of integrating and revising and supplementing prior publications, this publication will provide recommendations that come from our regional dialogues. So in this opportunity, I'm going to present the content of this upcoming publication, including the recommendations that were preliminarily discussed with you on April 8th and have been revised based on the feedback that we have received. So the publication is not ready at this moment, but in order to receive it as soon as it's ready, please subscribe to our Ethical Research Investigación Ética list, which you can do at PAHO's bioethics site, and you can always email us at bioethics@paho.org. I want to start by acknowledging all the participants in our regional dialogues on COVID-19 topics, which started on October 2020, including not just the panelists of the dialogues, but all the persons that attended and shared comments, questions, suggestions, both during the sessions and afterwards by email. I want to also thank our expert advisory team involving Bernardo Aguilera, Florencia Luna, Ricardo Palacios, Sofía Salas, Sergio Surugi de Siqueira, Hans Vasquez, and Argentina Jing. I also want to highlight the contribution, especially of two of my PAHO colleagues, Ludovic Reveis and Lionel Gresh. So the discussion, the dialogue that has led to this publication has not taken place exclusively as part of the regional dialogues. We've had many more smaller discussions involving national authorities, ethics review committees, and several groups in the academia that have been there not just to discuss these issues, but also to respond to some of our specific queries, because we've been trying to understand how exactly were different groups handling, for example, ethics review processes during the pandemic. So I want to thank again all the persons that have sent emails to bioethics@paho.org with comments and suggestions, and want to acknowledge the Wellcome Trust funding to conduct this work from the beginning of COVID-19, and PAHO's bioethics team, especially Sara Carracedo, Ana Palmero, Marcy Neal, Silvina Costa, and Aleida Domingo. As I said a moment ago, in this publication, we aim at integrating, like putting together, revising, and supplementing the prior ethics COVID-19 publications. So what we try to do is we try to revise to ensure more clarity, precision, and also consistency in the language. We've noticed that there was a need to revise some technical terms to ensure they were used in the most consistent and clear way. We also sort of cross the guidance in the sense that we make sure that the information that is in the guidance that's in one session in one of the guidance documents actually informs the content of the other sections. You will see that specifically in the section on strategies and procedures. Those were documents that were published really early in the pandemic, and subsequent documents pointed out additional issues that had to be incorporated in specifically in the procedures. So we also add a number of examples and lessons from the region. And we add additional pieces. We try to fill in gaps on topics on which there are some challenges, some confusions that persist. For example, pertaining to the use of samples and data for future research. And we finally provide a set of final recommendations that result from our regional dialogues.
I was saying chapter 1 has to do with the Zika outbreak, lessons learned, and challenges stemming from the COVID-19 pandemic. Our objective is to show that we do have lessons learned, because like we saw in the region, the COVID-19 pandemic found us much better positioned in terms of research than for Zika. Even before COVID-19, we had learned important lessons, like we explained in the document, and we had also identified some persisting challenges that were still lingering around after the Zika outbreak. So in this chapter, we share the regional response to COVID-19 in two aspects. First, implementing PAHO guidance, and second, conducting research. Now, in terms of guidance, we showed the actions that were taken in the region in terms of changing processes to do a quick and rigorous ethics oversight like the pandemic required, and also how informed consent processes have been reviewed and revised. Now, in terms of carrying out research, we not only illustrated the rapid response from the region, but we also analyzed the challenges we faced, because even though we learned and improved, challenges persist. And these are the challenges that were part of our collective assessment throughout the pandemic, through these dialogue sessions where we included a series of stakeholders, not only national authorities and research ethics committees, but also researchers. Now, in chapter 2, we talk about how to strengthen trust in research that is done in an emergency context, transparency, and society or community involvement, engagement. The issue of trust in research is highly relevant at the regional level, but also during a health emergency, it becomes even more important. When we talk about research ethics, we're talking about not just the tasks that the researchers, committees, and health authorities do, but also for society. And I believe that a significant aspect of the pandemic is that we made an effort in different areas in the region to try to reach to the community level, not only participants, but also the organizations. And so it was key to generate and build trust. And we saw more so than ever that there is a close link between knowledge generation and knowledge use. So research ethics, so to speak, came close to public health ethics, and we can give a lot of specific examples about this. We see that when people don't trust research, they don't trust the outputs or result of that research either, which happened in some cases with the COVID vaccines. And so we had to do a lot of work to build trust, not only in the public health measures, but also the research that led to those public health measures. So in this chapter, we address issues related to transparency. We had an earlier document from PAHO on actions to improve research transparency, but we also developed the components that have to do with community engagement. And we talk about community engagement, and let's so society engagement rather than community engagement, because we saw that at times when we talk about communities in countries like Peru, where we have indigenous communities, people believe that community refers to just indigenous community engagement versus, society in general. So we included examples of the multiple actions taken by our national authorities to address these challenges. And we also included recommendations for actions from our authorities, researchers, and research ethic committees. Now, chapter 3 addresses everything that has to do with research ethics oversight. And it says, how can we ensure that ethics review and research monitoring by RECs are agile but rigorous at the same time during an emergency? I believe that most of you are familiar with our documents on strategies and procedures. And what we're doing in this chapter is multiple things, actually. One of them is we are making all terms consistent for the entire review and monitoring process. So we use research ethics oversight as the umbrella term that includes ethics review of the research done by a research ethics committee before research begins, as well as the research monitoring process that is done by the committee, which sometimes is called uh, oversight in the specific sense of the word for the life, so to speak, of any given research in progress. So for clarity purposes, we are trying to make all terms consistent. As I was saying, in this chapter, we include the documents and previous guidance for national strategies to avoid duplication in review processes, as well as the procedures so that the way in which each specific committee reviews a protocol or monitors a protocol during emergency is quick and situation specific. It is also important to highlight that we need to include a previous strategy step. And this is a unique aspect of our region because we believe it was important to highlight the effort to think about a national strategy as a first step, because if we go to committee specific procedures, we could have a lot of committees that are going through their processes pretty quickly, but these procedures may imply duplication of efforts. Then the strategies were fine-tuned as well to try to capture the entire spectrum of possibilities, and we illustrated them with regional experience as well. And then as far as the procedure goes, that's where you can see this cross-referencing with the content of publications that came out later on. For example, we published guidance documents on the use of interventions outside of research, monitoring, etc. And those later publications now in these new publications are informing the content of our procedures. And also the SOP model is included as as an annex to the publication. Now, the next chapter has to do with how to make sure that research continues to be ethically accepting when new evidence is generated. We have seen that the task of monitoring ongoing research activities when everybody is researching the same thing becomes really hard. So in this chapter, we provide operational guidance, that is to say the procedures both for the research ethics committee as well as for the researcher that may have to assess the need to continue, modify, suspend, or cancel ongoing research, because it's not like once you get an approval, it's a blessing for life. It might be a proposal that at a certain point was ethically acceptable because, for example, the research question was reasonable and appropriate at the time, but then later on, that question may have already been answered, and that renders the whole research process useless. So we also provide substantive guidance, that is to say, questions that can guide the ethical analysis according to social values, scientific validity, etc. This substantive guidance or guidance questions are just a guidance. It's not an exhaustive list. And we also supplemented that with some additional questions coming from a PAHO publication to assess the ethics of using controls with placebo once interventions have already been approved. Now, in terms of the following chapter, we focus on how to ensure that in health emergencies, the ethical use of non-proven interventions outside of research is possible. Well, I believe that a key aspect is to clarify why it is important for a guidance for research to include the use outside of the research context of interventions that have not been proven. And a very important lesson that we learned in the region is that when it happens outside, when intervention outside of research that has not been proven before happens, even if it's not expected to be part of research, later we judge in retrospective that this and we determine that this not proved investigation, if the use is not justified, it's considered unethical research, because the conclusion is that if it's not proven, it has to be research. So an unethical use of non-proven interventions outside of the research context has a key impact on the trust in research. And that is something that we learned throughout the pandemic. We even have an additional justification to include this component, and that is that it implies additional and specific activities for research ethics committees and national authorities. So the content of this guidance once again goes over the ethical guidance of oversight, review, informed consent, and the contribution to evidence generation. So we try to make it easier by using these ethical criteria. So first of all, we need to ask ourselves whether there is a justification. And if the answer is yes, then and only then do we start analyzing how to proceed in order for the use to be ethical. So these four ethical criteria and the general and operational recommendations included in our original document, you may have noticed, were adopted by WHO in a recent document on this topic. So here we're trying to have more clarity on the fundamental aspects of these ethical criteria and recommendations. The next chapter addresses a topic that we had not developed previous guidance for during the pandemic, and that is how to ensure that samples and data are shared ethically for future research. Now, there are two main reasons why we included this chapter. One is that we noticed when reviewing existing literature, including our own publication for ethical guidance on Zika by PAHO, that we treated two different topics as one. One is the issue of addressing research outputs. You let the health authority what you learned, you publish it, etc. But then we have the second topic that has to do with sharing inputs for future research. Both researchers, as well as those who do surveillance, as well as the ones who provide care, can collect samples and data ethically in order to facilitate future research activities. So we realized that we needed to clarify that these are two different and separate things. And in addition to that, we needed to explain the importance from the very moment when data and samples are collected that we need to do it in a way that will make it easier to do research in the future ethically. The second reason why we believe it is key to include that is that even though this topic has not been widely discussed during the COVID pandemic, we have not talked about sharing samples and data. Why? Because since we were in a pandemic, everybody had COVID data and samples. However, we know that this was a pretty unique situation, and that this is a topic that will be important for future emergencies that hopefully will not have the same magnitude as this current pandemic. So in this guidance, we included aspects that had to do with ethically collecting data and samples for future research, where we included guidance that is included in the SIOMS standards, also in PAHO guidance. Since we had the Zika guidance, we have wide consent, and also what we have called the opt-out consent. That is to say, rather than opting in, you can opt out of a collection exercise.
Now, the other issue is how we can store, transfer, and use this data in future investigations with the purpose of fairly sharing this information such that it will redound to benefits to all of those who actually made the research possible, to the benefit of the population, participants, and in fair recognition of those who actually gathered that data, that information, the researchers. Final recommendations. We've had a very rich exchange with all of you, which has led us to rethink the language that we used. We had categorized a subset of recommendations, such as the pending regional agenda, but this is all part of our pending agenda. So that's why we have changed or modified the language that we shared a few weeks back with you, terms and categories, to not elicit the false impression that some things, terms are falling short. So these are the recommendations that it falls to us at this point to put into practice. Some are already ready to go, ready for action. These are the recommendations that are ready to be immediately implemented. They are called recommendations for action. Now, those that we still have to think through before putting them into practice. These are being called recommendations for conceptualization. So for April 8th, these recommendations for things that only apply to health emergencies, for which there's preparation, not all actions, not the implementation of all these recommendations doesn't necessarily entail having to wait for an emergency to happen. You have to do some pre-planning, but there are those that only apply at the time of an emergency. There are other recommendations that apply under all circumstances, including health emergencies, which, although they may be things that are worsened, exacerbated during an emergency, but there is no reason to limit their scope of action only to times of emergency. Now we have to consider all the different actors for each recommendation and type of action. And you'll see that those recommendations for action that are for emergency settings go toward health authorities, a scientific community, international organizations, for those recommendations, again, for action that are not limited only to emergency situations. There are those, again, for health authorities, ethics committees, researchers, the scientific community, and again, international organizations. A broader scope of recommendations are those that still have to be further defined conceptually. And for the academic sector, we've got research projects and theses, research theses that fall under that category. What are the recommendations for each one of these quadrants? I'll run through them quickly. For emergencies, recommendations of action for health authorities, for their action is for establishing strategies and procedures for swift monitoring during an emergency, not just COVID-19. Many of them already have that set up for COVID. We're talking about all health emergencies, review and monitoring. So we have to think about the advisability of strategies for a given period of time. If there is a health emergency that surpasses a given point of time, then there could be a transition to a different phase. This is being done by some countries also to allocate resources for implementing these strategies. And also there have to be rapid communication mechanisms between ethics and integrity of groups and authorities. Now, within the health authority, there has to be the signing of responsibilities. Anything that has to be done has to fall to someone to do it. So with the same rationale, we think that in the national response, emergency response team, there has to be a point of contact for research as well as one for other topics. Lastly, health authorities need to plan for built-in processes from the outset to make sure that countries actually benefit from the results of the research that's being carried out. If an emergency happens and research on that is happening, we want to make sure that that ultimately has a broader benefit than only during the emergency. For the scientific community, for international organizations such as PAHO health authorities, research groups, generally speaking, it's key to come up with generic standardized protocols before an emergency, to have them ready to go and outline, pre-approved by an ethics committee, such that when an emergency happens, then the details can be fleshed out and you can move swiftly to the approval of that protocol. This is something that was done in the case of the Zika outbreak in the region. This should also be done for future emergencies. Recommendations. There are many recommendations for action, which are not limited only to emergencies. There can be non-emergency situations for which these actions apply. Public and private research efforts should economically compensate members of the ethics committee for the time they devote to ensuring that that work be known, and also to facilitate the swift work that they do, recognizing the work done by the ethics committees, and make sure that the members of those committees are also fairly treated, that they be given their due, that they be recognized for the work that they do. That is key to ensure the professionalization of ethics review in research. And this needs to be improved throughout the region. It's becoming increasingly more important. Health authorities should try to incorporate the virtual way we've learned to work during the pandemic. Beyond the pandemic, we've learned about the informed consent process, and we need to make sure that this full menu continues to be implemented beyond COVID. We've also seen how important it is for committees, ethics committees, and national authorities to set up clear processes to ascertain what processes warrant being reviewed by that ethics committee. It's a matter of understanding what the criteria are, but not just that, any process that would pave the way for that to happen, make it easier. Public health surveillance cannot be treated as a research. There is a specific set of procedures for surveillance. We have to make sure that all activities receive the ethics review that is appropriate. Also, researchers, in sending in their protocol, need to report on whether that proposal had ever been reviewed by another ethics committee, and if so, to include that information. The ethics committee should create mechanisms, for example, via social networks that seek to communicate and interact with the public about any study, if necessary, should be the subject of oversight. These communication mechanisms, channels, have to be set up in advance. Health authorities should have mechanisms for reporting to ethics committees about anything that's been the subject of review by another ethics committee that was not approved. Was this research approved or not by another committee, to establish a network of communication, channels of communication? National authorities should require that all clinical tests, not just devices and medications, but be registered in registries that feed the ICTRP platform of WHO before beginning. There should be a web page that enumerates all the different research on human beings that has been approved in the country, such that any citizen can turn to that web page and see what is being done, what research is being done. And it's important to take on the task, follow through with the task of reporting to the public, communicating with the public about research being carried out to facilitate society engagement, to instill trust in the research. People have to understand what the research is, how it's done, what the ethical implications are. Working with communication offices, that responsibility needs to be taken on of reporting to society, the public, how the research project is being carried out. This is something that we hear about a lot, to doing advocacy to strengthen scientific journalism in our region is also important. National health authorities and international organizations such as PAHO should do advocacy to ensure that the scope of the ICTRP platform of WHO include all research on human beings with human beings, not just the clinical trials. Recommendations for actions should not be, that aren't limited to only two emergencies, entail a task of capacity building in that research. There are many relevant players, and we have identified a series of topics. It's not exhaustive, but something that's been raised regularly that should be prioritized. These are research ethics training efforts, distinguishing human research from other public health activities. We've also brought up the MEODI framework, the use of ethical use of samples and data for future investigation. The different studies, risk studies that are done with human beings, online studies, scientific integrity, and other ethics and integrity obligations need to be adhered to. And it also has to be decided what needs to be told to the public, again, to build and maintain the public's trust. There are some tasks, as I said from the outset, that are for the purpose of conceptualizing that falls to all of us, and I call upon everyone to contribute to this effort of conceptualizing regional undertakings. Some are for emergencies only. For example, we have to think of mechanisms for the coordination of research to avoid duplication of efforts, and to undertake more studies on that are multi-centric and done on a network. And even before research is ready to be registered, to be on the list, it's so important for people to know what studies are afoot, what it's about. There have to be strategies for regional collaboration as well, to be capable of carrying out a regional multi-center research. We know that that entails logistical challenges. We have to find a way to overcome these logistical difficulties, be capable of doing this. We have seen how multi-centric research or clinical tests work, how important they are, and we need to also carry out regional multi-centric studies in Latin America. There are also mechanisms for ethical oversight of research and monitoring that we are not using, and we should think about what ways exist to make use of those strategies and mechanisms that aren't currently being used. For example, ethics reviews beyond the borders of our countries. How can we make sure that this actually comes to fruition, becomes a reality? And recommendations for conceptualization that don't only stem from emergencies, what strategies we should think about, what strategies can be used to facilitate ethical oversight. Multiple committees are working together to carry out this ethical oversight. If you're talking about a coordinated study, that there be some type of coordination in the review process with simultaneous interpretation, or to avoid duplication of efforts, prior trust reliance agreements could be set up so that if a given project has been reviewed already, for it not to have to be reviewed again by another ethics committee. So I encourage all of you to continue carrying out this work, and this that is left to us under the category of tasks for further conceptualization, for further thought. Pajo's list of ethical guidance is something we are sharing with you. And I thank you all very much on behalf of the whole team for all the work we've been doing throughout the region in a sustained way, this ongoing sharing of suggestions and challenges of information throughout the pandemic. I'm going to share my screen, and I invite you to take part in this exchange of suggestions, comments, and I invite my colleagues Sarah, Caracedo, Aleida, who've been a part of this process from the beginning, Sarah, from the beginning of the pandemic, to have them moderate the questions, please. And also to contribute with your answers to the questions that are going to be asked of us. Thank you very much. Thank you, Carla, for that presentation. Now, remember that we asked the questions to be put in the Q&A function. We do have one that has to do with broad, informed consent and the regulation of the use of that consent for databases or data and biological samples during the pandemic, public biobanks, public and private biobanks. Does anyone have anything to say about that? And perhaps you could tell us a little bit about Argentina's experience. Yes, I'd be happy to. Let me read that question through again. So this is about broad informed consent of the biobank. Well, generally speaking, as you know, the ethical guidelines on the use of broad informed consent for biobank, that's guideline number 11. That is where you can find the ethical justification why or how to use broad informed consent, how this has to do, what this has to do with the ethic guidelines themselves, and how this is done in each one of the countries. And what is important, this is also set forward in the guidelines in order to have a broad informed consent for someone to actually authorize that the samples be kept in the biobank samples. That biobank has to have a governance system that ensures, generally speaking, the protection of the rights and interests of the participants, the community, and also to protect the quality of the data and samples being stored. And also the oversight that's done of this falls to an ethics committee. A research ethics committee isn't just going to assess future studies, but also that those future research projects be in keeping with the commitment that was undertaken with the donor at the time that donor's sample was taken. It has to be follow through on, because if there's a breakdown in that, then the whole idea of broad informed consent falls to pieces. You have to have this mechanism underway to ensure that those original terms are upheld, even if the research project takes place much later. So there has to be this governance process to regulate the system overall. Thank you. Well, just as an ethics committee ensures there be rigor in the informed consent process, and of one type, it also has to do the same regarding broad informed consent. And furthermore, and I do think, well, this might sound a little bit strange, what I'm about to tell you, but I do think that sometimes concern about the use of a broad informed consent about research, that is data and samples for future studies, applies because we are conflating concepts of ethical review and informed consent. Now, that may sound odd. How are you going to confuse ethical review with informed consent? However, oftentimes I'm asked, don't we have to do an ethical review of this protocol? Or we don't have to do it because there's already informed consent for the samples. Well, apples and oranges, all research with human beings, even if you're talking about research with samples provided earlier, still has to go under an ethics committee's review. That's what the ongoing ethical governance means regarding samples and data. Samples and data, the fact that it's been left with informed consent for future use doesn't preclude that there isn't going to be any need for ethical review of future research. That's something we don't stress enough. And in the document, we're looking at different realms. We ought to think about whether all researchers are capable of taking data and samples for future research. So we should see whether all of the data and samples collected for research, all of the samples and data gathered can be used in an ethical way during research. That's what we have to make sure happens, because ultimately research is to bring well-being and health to our communities. That's what it seeks to do. So we have to be very informative in this process, and there's an opportunity here for us to carry out more ethical research that we can all benefit from. There's something I would like to add, Carla, regarding the question asked by Fernando. It's true that biobanks for clinical trials is a unique situation. We could add that to the agenda of those matters to be further thought out for the future. Now, in clinical tests, nowadays, there are broad informed consent processes for this research and guidelines, but sometimes the committees in the countries don't always have the tools to ensure that this actually happens. And that is where the problem arises, because we're missing that leg of the stool of making sure that there's governance that follows through. There's a lack of regulation there in countries, which hinders countries from having the tools to ensure that that broad informed consent not just be dead letter, let's say, when the research actually happens. That's something that we have to do in our countries. And as an ethics committee, this is something we need to advocate for. That to be clear guidelines. How does this consent actually work, and how can samples be transferred? What needs to be taken into account when samples are transferred? Are limits going to be placed on how they can be used? That all has to be clearly regulated in our countries. I thank you for that response to that question about broad informed consent. Now, here's a question / comment. Now, the pandemic, it would seem, is about to end. And so what are the next actions on these matters? Is PAHO going to promote their implementation? What are the concrete actions that authorities and countries need to have on their radar to move forward with the ethical review process? Thank you very much for that question. It's not that publishing the guideline be at the end of the process. It's really the beginning of a new process in which we are going to have to work very closely with everyone involved, all the stakeholders, with these recommendations to put into practice all of those recommendations. Changes aren't brought about by merely publishing a document. Publication helps, but does not solve the problem. So now we have to do the hard work at PAHO. And by way of example, we do plan on training about those topics that have been addressed, have come up. You will see that we will be convening groups for training on specific matters, and also national authorities will be brought together for this. I think the action here isn't just for us. I think you all have an important role, advocacy role to play as members of an ethics committee that can sit down with the committee and see, well, there's a list on the publication of 5 tasks that ethics committees need to carry out. And so let's do our 5 tasks. That could be our agenda, and national authorities. Now, without a doubt, we will work with them, but I do think that you have a very important advocacy role to play at PAHO. You'll recall, we always talk about research and ethics systems. Everyone has their roles to play. And so we're going to have to keep working along those lines.
I wanted to add that this is quite a significant reflection, because part of the reason why we're not that well prepared for this emergency was that we did have the science rules, we had some guidance, but we did not have the details on how to communicate with the authorities and the other stakeholders that are part of the research ethics activities. So hopefully after this guidance, we will begin working with all of the stakeholders. But Sarah, it's like there's always a two-step process. First of all, you say, okay, we have to take action, and then you take action. So originally, we should commit to not just saying we have to and say, okay, we know we have to do that. That was the situation pre-COVID. We have to develop strategies to have a quick review during emergencies, but very few countries had actually make these strategies formal beforehand. But at least we had that we have to mentality, which is at least one step ahead of where we were when Zika started. But now we have to take both steps. We have another question on the chat that I find quite interesting, that talks about the diversities in each country, the different scenarios. So how can we strengthen both research ethics committees as well as the agencies or the institutions where clinical trials are performed, so that research ethics are implemented ethically above and beyond just reviewing the documents? I believe this is important because, Carla, this goes back to what you were saying about thinking about research ethics as a system. That is to say, it's not just up to the REC, but rather it involves all of the players that are part of the research process, including the facilities, the researchers and their team, participants, research ethics committees, and also, of course, health authorities. So how can we ensure that the process is ethical and not just to fulfill the process of, the ethical review component? And if we go from top down, we have to have clear incentives for ethical review processes, and each players must have a clear idea of that if they are doing any kind of research, and to build capacity in their agencies, that is to say, to train their own researchers, their own resource staff. So we need to provide research ethics training to each one of these players to make sure that we understand that it's not just up to the research ethics committee to make sure that any and all studies are performed ethically, but rather the entire process follows ethical principles. So we need to focus on the ethical review or our protocols as well as oversight, but also to build that into any and all aspects of the research process. Of course, and I even I included the indicators document. Oh, I'm going to paste it to everyone. I made a mistake. This is the document on indicators for research ethics national systems. This could be relevant to the extent that it also identified specific activities for the other players, including the issue of scientific integrity, which I believe is also implicitly included in Alejandra Almenda's questions. That is to say, it's another component of a research process that is not always mentioned, but that we will mention in our publication. The region had already brought this up even before the pandemic. We had to do more about this. There's a question in the Q&A that has to do with the sample use. So Marina's question is whether we have samples stored and then the researcher wants to analyze them later on a reason that was not taken into account at collection time, whether we need a new protocol. The answer is, of course we do. We need a new protocol and we need to ask for authorization to see if we can use these samples. And this is when this system kicked in, if there was a broad informed consent to see whether or not those samples may be used. That is to say, if the purpose of this new protocol matches what the person consented to in the original paper document. I have a question that has to do with the challenges that we ran into during the pandemic in the region and the ways in which we should try to address these challenges, which came up throughout these regional dialogue sessions that we carried out since the pandemic started. We know what the barriers and challenges are in other parts of the world, especially for other countries, the low and medium income countries. And maybe it's interesting to share with the individuals and authorities from these countries this regional reflection. And that way we might learn even more. I don't know if Carla knows about what's happening in other parts of the world. Yes, it's interesting. And it's actually a good opportunity to tell you a little bit about the outlook for this region compared to other WHO region. We in the region of the Americas are considered the only WHO region that has a regional bioethics program. I don't know if you know this, but PAHO created the regional bioethics program in 1993 upon request from the government of Chile through a three-way agreement between the Ministry of Health in Chile, the University of Chile, and PAHO. And 10 years before that was 10 years before WHO even established its own bioethics unit. So PAHO has historically given priority to the bioethics aspect, not only in terms of WHO at the global level, but also compared to other regions as well. We are not only the only region that has a regional bioethics program, but also the only one that has specific mandate from the member state governing bodies to take action in bioethics. And when I look at the discussion that takes place at the global level, like I said at the beginning, oftentimes I see that pessimism kind of takes over a lot of the judgment in other regions. I tend to be pretty optimistic, but I think that whenever the work is allocated to a person, gets done. But if you don't have a responsible person to sit down with the national authorities or the committees, etc., then things kind of get diluted and nothing gets done. So I believe we have a lot of opportunity to strengthen the dialogue in our region with other regions. And I also believe that the experience from these dialogues, even though we had a lot of like regional series, so to speak, before, I believe that it wasn't until COVID that these regional sessions became actual opportunities to share. Because to be honest, what I saw before is that I invited the region national authorities, RECs, and everybody was like, we're doing a great job. Everything's perfect. Everything's good. And we didn't really have an opportunity to see, okay, there's a challenge here, or I'm doing pretty good in this area, but not so good in this other area. So there was no genuine dialogue. And in addition to this upcoming publication, having collectively created a forum where we can honestly share ideas and you can hear other people that are in different roles, because it's not just the ethics people that get together and talk. We have learned a lot from talking to others, from bringing researchers that from their point of view, they can tell us how to improve the ethical review process. So this is something about the experience that we have to share with colleagues from other regions. We have a question on the chat. It says, what's the best way to make healthcare professionals aware of the importance of having informed consent? Well, obviously, this document has to be an additional requirement for a clinical procedure, and later on it can be used for research processes such as the COVID-19 tests. This is quite an important point that has to do with this need for training and to take a look at this with a system-wide approach. Because even though ethics committees go over the informed consent and take a look at the content and make sure that it's explained properly, unless there's an actual consent process, again, it's quite useless. The paper itself is just a guide for researchers to be able to explain what's going to happen during that informed consent process. And the way of making them aware is through training. So undoubtedly, as part of the research agency, being the research center itself or research bodies from each one of the countries, there has to be training on these ethical matters, especially around informed consent, and to share this experience on what the informed consent process is like, how to communicate with people. This is something that you learned. It's not something that you're born with. You know, you need to be able to communicate with others. I have run into situations where researchers said that it was quite impossible to properly communicate with the participants. And the bioethics committee response was, well, have somebody else do it. Obviously, clinical trials are a medical responsibility, but to be with someone that has more people skills, that can use different tools such as, I don't know, drawings, videos, what have you, anything that would help in that consent process. But anyways, I do agree that we need to train our researchers in that process. Like I said, this is not something we are born with. Maybe not only researchers. Going back to what Anna was saying, I believe that if we as PAHO's regional bioethics program think about how our work has changed during the pandemic, one of the answers has to do exactly with this. That is to say, to get closer not only to our colleagues from our communications office, but also for the first time, we were able to produce communications material for a broader audience and using different tools, videos, infograms, and other ways of getting the message across. As part of the recommendations, at some point we mentioned that health authorities must truly take on the role of communicating with society. And this has to do with working with the communications office at the health authority institution. They have to work hand in hand with the office that rules research ethics. And at the beginning, I was saying that it wasn't just researchers that we need to take into account, because in the region, we saw that since we talk so much about informed consent in the research context, sometimes in other situations that are not necessarily research related, and I even heard about this in research conferences in the region, people say that there should not be any kind of informed consent in a care situation. But we're talking about people. Of course, they should be able to choose for themselves. So there has to be an informed consent in other areas as well. Now, there are some epidemiological surveillance contexts when it may not be applicable, but we need to start talking about informed consent above and beyond the research context itself. And we need to make people aware of what an informed consent means. But again, I'm an optimistic because I believe that in the region, a lot of progress has been made in this area. In the past, we were obsessed with having the paper signed or the document initialed or whatever, but COVID turned everything around. We were able to focus on the most important aspect of things. That is, why do we need an informed consent? Why does it matter? And that is why it's so important to have all these learnings collected and used in the future.
I'm reading that there are some new questions. I don't know if you have read them, Anna. They're in the Q&A. Well, there's one here from Fernando on the issue of scientific integrity and political interference by authorities in these topics. I would imagine that he's referring to at the time when public health decisions are made. On the next publication, a call is made to strengthen the region's capacity in different areas of ethics as it involves research. One is scientific integrity, and we must remember that the indicators on this, there is one on this. They're not all equally rigorous in every country. That's what we have to strive toward. And this is also something we've seen coming out of COVID, the need for us to strengthen these indicators, these for scientific ethics. I would just stress that what Fernando said is very much in line with the overall reflection that the pandemic is what has brought research ethics closer to the public health response ethical aspect, what actually drives research, the need for research. But there are some issues that need to be fine-tuned regarding the obligation to publish the results of research, for example, is one of the issues. That's not something that's left willy-nilly. It's not something you do if you feel like it. It's an obligation. If you look at the guidelines and the social value of scientific research, that value is only real if research results are reliably, faithfully communicated or made available to the public. So some are setting this obligation apart from others. It does need to be better explained. And I would just take this opportunity to recognize the work done by our colleagues at BAHO with carrying out this ongoing analysis of evidence for decision-making during the pandemic. But oftentimes, there is this perception, and that's where we have to do our advocacy, this idea that when there's emergency, evidence isn't important anymore. It's exactly the opposite. You have to have evidence. If it's limited, well, then an ethical analysis has to be done even more so on that research. So I would just say, Carla, in addition to this aspect, one of the big deficits we have is on conflict of interest. Not just within the political realm and other realms, it can be institutional as well. And we have to have clear policies. And as a researcher, we had to have these guidelines. So it is very important for us to hash that out. I think that what we've done is downplay the importance of responsible behavior during research, as if it's always something obvious, intuitive. And the fact is, we have to approach this in a more serious, rigorous way, assigning responsibilities for institutions in the indicators that Sarah mentioned. We can start at where it's simplest. We have to define concepts first. It's not just good and bad. There are specific issues that have to be, guidelines have to be defined. And we have to have institutional mechanisms at different levels for us to act on this. Now, the last question perhaps has to do with informed consent. This comment reflects something that is part and parcel to this. And the pandemic has shown how important this is, as Carla has said, that we get into the substantive part of informed consent. And what are all the different ways I can do this in an ethical way? Because the fact that this is being done in person or in writing doesn't make it ethical. What makes it ethical is that people's will be respected, that information be made available, and so forth. I think therein lies the response. I don't know if Carla has anything she would like to add. We've become so accustomed to the pandemic, we forget to how things were before. Before, people thought that it was impossible for us to have a dialogue if we weren't in person. We're doing it right now. This isn't less real because we're seeing each other virtually. There's still a dialogue. So, and the same can be said about informed consent. It's not because the person is there physically in front of you and signs by hand the consent. That's not the only way to clearly express consent. Just to underscore the fact that we're talking about a process when we talk about informed consent that seeks to engage participation in the research or whatever it is, to ensure that anyone involved in research be doing so voluntarily. They can ask the questions, have to ask, they make a decision. Once that decision is made, then the person expresses that decision, which is usually done via a signature, can be done in different ways. What we have to keep clear is that that is just part of the process. And what we try to do is ensure that this is be a process that is transparent. Now, I do have a specific comment about oral consent. And people think that because it's oral, you can say whatever you feel like saying, but that's not the case. You have to have a script. Ethics committee should require every time there's a proposal that there be carried out any type of oral consent process. There has to be a script for that. Thank you. I think that brings us to the end of our session. Now, Fernando says this is just one more step along the way, along the path. I like what he said. And we do have to be prepared in advance for health emergencies. Yes, I agree. I was looking for something to share with you because there's a comment here, a question about how international organizations could advise on correcting epidemiological data issued by national authorities, at least in my country, when that data presumably is incorrect. So I would like to share with you. I can't find it, perhaps in the link, Well, let me just give you the link here for you to sign up for the listserv of PAHO Evidence Hub, it's called. That list, which updates the work done by the organization on evidence. I do think it's very important for many of the matters that are being brought up during this discussion as regards correcting epidemiological data, generally speaking. I think the best thing is to first explain what information is going to be gathered as part of the surveillance effort, and the results shown by that data, by that evidence, are the ethical guidelines for epidemiological surveillance that have to be followed. I'll share that link with you. This was published by PAHO in 2017, I believe. And you will see that it's not just an ethical obligation for surveillance, but also an academic tool about ethical governance. You've got 15 on emergency situations.
So this means we need to share information with the relevant parties. But again, ethical obligations do not end there. We also have obligations with the population as well. And I believe that as we move forward with our work, this is something that we must continue to work with or in the region. I don't know, Anna, if there's anything else you would like to add or you have any additional comments. Yes, as far as that question goes, I don't, honestly. Well, not necessarily about the question. It could be like a closing remark, I guess. Yes. Well, to close, I would like to say that I do agree that we have made a lot of progress, which was, I guess, a good thing among all the bad things that happened during the pandemic. We had a lot of collaboration work, a lot of people that started focusing on the importance of this work and to move forward in spite of all the deficiencies and difficulties that we face, the amount of work and the mountain obligations that we had. It's truly striking to see how the ethics committees were able to work with resilience to be able to address the situation. And my takeaway is let's learn from this. Let's not lose sight of the importance of having all of this in writing. And Carla, like you said, this is a compilation of a lot of work. It's collective work. This is not something developed by the WHO, but it's rather the contributions from each and every one of the countries and the contributions we made as the region. Thank you.
Yes, this is a regional production. I agree with you wholeheartedly. I would just underscore once again, this was financed by Wellcome Trust from the beginning. Wow, the production of the publication is still going to take a little bit of time. We didn't want to have there be any delays in this reflection process with you, because that's what we're doing, engaging this collective thought process. So while the link to the book isn't ready yet, this recording is going to be available on the Regional Bioethics Program's webpage. We will share this and the list of bioethical research. I forgot the other thing I was going to say. As soon as we have the document in both languages, we are preparing it right now in English and Spanish. As soon as that is available, we will share that link with you. And so that's an agenda that we have before us for further work. That list of recommendations for conceptualization is something that falls to all of us to do. Anyone who's working, for example, an ethics thesis for research, just take a look at the recommendations, the final recommendations for, as we're calling it, conceptualization. You can even do your thesis work on that. One of those outstanding pending tasks that we have before us could be the subject of a thesis work or research project. So I see that there are some more comments. Yes, we are going to continue holding these dialogues. We are going to continue using this format because it has enabled us to make so much progress as a region, and we see how similar the challenges we all face are. And the cycle focuses on the concrete tasks that result or come out of the final recommendations. I don't know if you have any final words, Sarah? Nope. I would just thank all of you again, everyone who has been a part of this regional dialogue process. All of your comments, contributions have enriched this process. I thank you all. Thank you, and have a wonderful afternoon.